We welcome in from LifeWays, Director of Crisis Services, Wade Stitt, and Crisis Services Supervisor, Jessica Ciccelli. Welcome to the show.
Thank you, Bart.
Yes, thank you for having us.
Yeah, great to have you here, Ciccelli. Did I say it right?
You did,
Am I supposed to put a little flourish on it?
Ciccelli. Yeah, exactly. That's right.
Well, we, of course, as a community, we're standing Spartan strong since the tragedy a week and a half ago, but the impact is going to be forever for some people, particularly those that were there.
Sure.
But I think for a lot of people in our community, it's really a close-to-home situation. Oxford was close to home. The swatting at Jackson High and in Jonesville, close to home. Are you seeing evidence among our teens and school-age students that they're getting affected by all of this?
I mean, I think not only just by these incidents, which are very traumatic, Bart. I mean, obviously just from the community and not just from us looking at this, but folks that are, struggling with mental illness and seeing something like this occurring in our community, it has such a massive impact, especially coming from the pandemic, which the acuity level or severity of mental illness that we've seen in children and families has significantly increased throughout the pandemic. And I think that will also be something that we see years to come having an impact on our kids and families and even adults.
Yeah, I think all parents want to protect their kids. We were talking before the show, Jessica, that a lot of families, shielded their kids from stories like the Uvalde or the, you name it, the shooting of the day. But you can't, and you don't advise that either, do you?
No, because they're going to hear about it. They're going to hear about it from other kids, and I think we can control the message and the way that we tell it to kids as adults and as people who interact with families and children, and we can teach parents how to have those conversations and how to introduce topics that are really unprecedented and something that we've never had to explain with such frequency before.
You are offering tips to families to help their kids in particular cope, and how a parent or an adult responds to the crisis, that affects the children and their response too.
Absolutely. Well, I think one of the first steps is even as adults, when we see these things happening, it obviously has an effect on us as well. How could it not, right? This is happening in our community. When we're talking with our children, it's very important that we be willing to have that conversation, that we don't shy away from that, right? But making it age appropriate, making it so that when you are talking with your children about this incident, that you are clear about what's happening, things that they can do to stay safe in situations like that, and be very clear about just the different resources and things that we have around us in our schools and our community mental health, those types of things that can be a resource for those kids and parents and adults that may be struggling with this type of event occurring.
Do you actually hear from kids on your crisis line?
Occasionally, yeah. And I'd say more frequently since the pandemic. We've gotten calls from more adolescents and kids who have gotten their information either from parents or gotten our crisis line from their parents, or maybe they already received those services and they wanted to reach out and talk to someone kind of outside a scheduled time or kind of on an as needed basis. And
you've got, in many cases, different age, different grade levels of kids in a family. Do you approach these topics differently based on the grade level of the child?
Absolutely. Yeah. Having and Jessica's actually our supervisor for our ICSS, it's our intensive crisis
stabilization
for the children. And so we've seen an increase in school visits. We spend a lot of time getting called to schools with children in crisis and even homes, of course. But absolutely, the message needs to be age appropriate. It needs to, you're talking to a younger child. They're not really going to understand a real in-depth conversation about it. So certainly making age appropriate. And I don't know, Jess, if you have any more feedback on the feedback for a younger child versus an adult.
And I mean, I think the parents and the people who work with the kid will know on an individual basis kind of what their understanding is, what they have talked about before, or if they've had some similar conversations. I know even some of our staff talking to their own kids when the schools were closed, they had to have those conversations and breaking it down to, well, someone did something that was bad and hurt other people, so now we're trying to keep other people safe by, and they just really simplified the message. And I think he was 5 and they were trying to explain these things. So just, yeah, it really depends on the kid, but breaking it down to some of these little ones is tricky.
Yeah, I was talking to a parent of an elementary kid, and they were talking about the Michigan State, and the child said, "Oh, we already trained for active shooters." It's like, oh my gosh, you hear a second grader say something like that. That's numbing.
Yeah, absolutely. One of the things that occurred when the MSU shooting occurred is our CEO, Mary Beth Leonard, had reached out to MSU and to CEI, Clinton, Eaton, and Ingham County Community Mental Health, just to offer our support. And so we have been able to send over folks that are part of our CISM program, which is the
Critical Incident Stress Management.
Anagram. Sorry, it's one of those, got to remember all of them, right? But even today, we have folks that are there at MSU that are helping with some of the discussions and debriefings and things of that nature that I think has been really helpful as well. So.
And I've heard there are kids that they left campus and they haven't been back.
I can imagine, yeah.
And what does the parent say when a child says something like, I'm afraid to go to school?
I know part of it is talking about who they can trust and who they do have. They can talk about having availability of their trusted teachers and police nearby and things like that, and just kind of pointing out the resources and the trusted adults who are around can definitely help some kids.
You have a lot of services, and it's awesome that Mary Beth Leonard dispatched folks to help in East Lansing. You want kids to know about LifeWays, and every high school kid has a phone, and it's okay. It's okay for them to call you.
Yeah.
Absolutely. Not just call, but even if it's a situation where they come into our crisis center or wherever they at, they can call us, and we can either come to them, they can come to us, we can just talk to them over the phone. And again, that goes for both children and adults. We have a 24-hour crisis center that is here for this community, and we have folks that are there 24 hours a day that can really just sit down and are trained and know the resources and things that can help in those types of situations.
The emergency services, which is fairly new at LifeWays, can people just show up? Like
Absolutely, yeah, yep. Like he said, we have people on site 24 hours a day now. We have our 24-hour crisis line and have had for years. So we are just continuing to expand our availability and our resources and our network, and it's really great.
Awesome. Great to see you guys. Thanks for your tips. Thanks for coming in today.
Yes,
Thank you so much
for
Mark,
having
having
us.
us.
Yeah, and you can find out more at lifewaysmi.org. All their great services and great team available to everyone in our community. Thanks to Wade Stitt and Jessica Ticelli from LifeWays.